All right, now, just 2 days after the globe marks the World Refugee Day, the United Nations High Commission for Refugees has announced that more than 1.1 billion shillings worth of infrastructure in form of schools and hospitals in Dadaab camp now lies idle following the closure of 2 camps in Dadaab. Now, the infrastructure includes several fully furnished hospitals and schools, which UNHCR hopes to hand over to the government, even as locals remain pessimistic. The facilities will indeed be used to benefit the community within and around the camp. Timothy Etino reports.
Since the repatriation exercise was announced by the government 2 years ago, over 14,000 refugees, mostly from Somalia, are reported to have gone back home. Already 2 sectors within the expansive Dadaab camp have since been closed. Cambios sector shut down in March 2017, and E42 camp, whose last resident left on the 26th of May this year. And with the mass exodus, empty facilities such as these are left behind, with the United Nations High Commission for Refugees contemplating a handover ceremony for several schools and hospitals within the 2 closed camps.
We are engaged in constructive dialogue to see how soon we can organize the official handover ceremonies.
The UN agency is expected to hand over more than 10 education facilities, including schools in Cambios sector with a capacity of over 8,000 learners, and similar structures in E42 sector with over 16,000 capacity for both primary and secondary school learners.
In Cambios, we had 3 primary schools and we had 3 early childhood development centers. Those are the kindergarten, the early childhood centers. In E42, we had 10 early childhood development centers. We had 10 primary schools. We had, of these 10 primary schools, 6 were temporary structures and 4 permanent structures, including a story building classes.
The E42 hospital remains deserted. Just 6 months ago, medical staff here would be a busy lot. Today, the equipment lay idle, with the facility with a bed space of 100 left at the mercy of the Garissa County government.
There is emergency room, there is a lab, there is a 2 operation theater, there is adult wards, pediatric ward, and stabilization center. There was also in the hospital the area for outpatient consultations, specialist consultation, which we did non-communicable diseases and mental health.
The infrastructure in E42 is worth $7 million US. 7 million. Infrastructure in Cambios is worth 4.5 million.
The United Nations High Commission for Refugees has announced a drop in the number of refugees at the Dadaab camp from 245,000 3 years ago to 231,000 now. And with plans to hand over the facilities to the government, it's not yet clearly outlined how the communities left behind will directly benefit, with past accusations by residents of the area citing favorism of refugees over the locals who have limited access to quality education and healthcare. Timothy Otieno, KTN News.